Okay. Hi, my name is Janie McClanahan. I'm the director of the ICU department at Paris Regional. We are here to go over some intra-abdominal pressure monitoring. It's something we plan on getting started. We've been looking at for several months, and y'all have been identified as the super users in the ICU. Can you introduce yourself?
My name's Amanda Kemp. I work night shift.
Jamie Newworth Days.
Okay. Glad you're here. Hopefully you'll enjoy it and you'll be as excited as I am. Okay, each one of y'all have got a packet. It includes some information. It has several things in it. First of all, it has some algorithms, and it has the BARD monitoring. Okay, let's go with that. Let's look right here. What is the definition of our IAPM?
Intra-abdominal pressure monitoring.
Tell me what you think this is.
It's a way to monitor the pressure inside the abdomen.
Correct? Okay. Tell me, Jamie, what is a symptom of a patient that comes to you that you would think that you might look to see if we need this?
Shortness of breath or abdominal distension.
Okay, good deal. As we go through and look through, follow your packet. I'm going through your brochure. Okay, we're looking at the measuring. What is a normal measurement? I know that we've been going over this for months and months, so y'all are very familiar with this. What would be a normal measurement of an intra-abdominal pressure?
5 to 7.
Okay. At what point are you calling saying, hey, we have a problem, we need to be looking at this?
Above 7. But greater than 15 is associated with in-organ failure.
Okay, good, excellent. As you go through, I gave y'all in your packet, I gave you algorithms to look at. We have things that you want to, it makes it really easy to do, because what you're going to do is you're going to go through this, you're going to learn it, and you're going to go back and teach your coworkers. Okay? So as we look through your algorithm, it's very easy to follow. Let me see this so I can change this to, no, I can't, it's not on there. If you look through there, it says immediate medical treatment options to reduce it. Okay, if it's greater than 20 with organ failure, if you'll look, it says yes, then you go through it. If it says no, then you'll do serial monitoring. Okay, this is actually done with a use of a Foley catheter. BARD has been nice enough to give us these as to use as teaching education. So I'm not going to tear this open, but when we get through the class, you have got everything you need. We're going to walk through this. We're going to attach one. We're going to pretend that we're measuring. So you are very familiar with the setup as you look at this. It goes step by step. In step 1, you've got your saline. As we go through this, at step 3, to flush the lines, remove the bubbles. It's a lot like your art lines. Okay, you're going to be looking at it in the same perspective. It just gives you another monitor. Your cardiac output, your SpO2 numbers, and now you've got this one. It's amazing what we can do when we start looking at numbers. Okay, anybody got any questions? Do y'all have understanding? I know that y'all played with this a lot already, so you're very familiar with it. So does anybody have any questions about that?
Not so far.
Once we get through, we will open up our kit and we will play with it. So we're familiar with how to hook it up and how to set it up with the saline. We'll have saline. I've got IV poles and we've got saline to look at as well. Okay, in your kit you also have this diagram. I think I have it on the board. Let me see. Nope, maybe not. Okay. It's what happens to the body's organs. If you look at this, this is really a very detailed diagram of how the pressure builds up, what causes it, and what chain reaction that you have when this happens. Okay? So if you look at that, when the body starts spacing, you see the lungs, you see the pressure, you see the edema. And you'll see right in the stomach part, as the intestines rise, the elevated intra-abdominal pressure due to bowel edema. You never really think about it like that, but there's so many pieces to this. And if we monitor this number, you'll be surprised how many patients will catch on the front end instead of something on the back end. So it's a very good trigger for physicians to be able to say, okay, what's our number? let's start looking, okay? So when we go through this, this will be a diagram also you can use in your teaching. Anybody got any questions about this one? Okay. So Jamie, what kind of patient do you think that would roll into ICU that you would see as somebody that automatically brings to mind that you would put this on?
Second.
Absolutely, absolutely, it's a good catch. Even from an ER perspective, trauma patients, it's a good monitoring technique. Very good monitoring technique on that. If you look at your last page of your brochure, and you start looking at it, and you're like, it looks just like a plain Foley, but it just has the syringe that helps us monitor. So it shouldn't be anything that's too difficult. It's just gonna be, we gotta develop flow sheets for how we keep up with the numbers. So that I will come back to y'all in another class and look at what forms we need to monitor our numbers, so that way we can trend it. How often do we need to monitor the numbers, depending on what they are? You know, we do serial or do continuous, so we will look at all of that. So basically right now you have symptoms that you know to report, you have the numbers in your packet to report, you have a step-by-step application of the Foley that monitors it, and you have a flow sheet that tells you to go through it. So do you see anything that we've left out that would not help you in teaching your coworkers?
No.
So once we're through with this, what I also have gave you is a post test. It's only 4 questions. I want y'all to finish that, turn it in. I will turn it in to HR, make sure it goes on our competencies, because every nurse at ICU will have to do this, and eventually we're gonna go to the ER with it. So it'll be done there. You also in your evaluation packet have an evaluation form. So I know this course is really short, sweet, to the point, but we're gonna spend most of our time playing with the Foley, setting it up, getting numbers, and practicing that. Any questions? Okay. I think pretty much we have covered everything. I need to also, for y'all to be sure and do a skills check off. Every single coworker you have, we have to make sure we have a skills check off. So we will make that form as a group, and then everyone will have one in their HR file. All right, anybody question on that? Have anybody problems doing that? Okay, so at this point, we will get up and we will play with the Foley, and we'll start this meeting on another day. All right, we'll schedule another one. All right, thanks guys.